If your mid-back feels tight no matter how much you stretch, the issue may not be in your mid-back, but more of a rib cage issue. So what is going on here is your rib cage has to expand with breathing. And so when that is not taking place, your mechanics of breathing is off, and you're not using your rib cage muscles properly, you're not managing the rib cage positioning properly. The compensation patterns that take place involves your mid back, it can involve your shoulder joint, and it can involve your neck as well. So you can be stretching those parts or your mid back and still having the result. When it comes to stretching, I really have an issue. The reason I have the issue is because a lot of times people think stretching is the solution, when in reality, the solution is finding out why something is tight that now requires stretching. If you have subscribed to my channel, which if you haven't, please make sure you do, you are very well aware of my approach to solving biomechanical issues that involve our body parts, joints, movements, and balance, coordination of movement. So let's talk about the rib cage. There are muscles that actually manage the positioning of rib cage, and those muscles are primarily involved with breathing. So then we need to address the breathing and how to breathe properly. I'm talking about biological breathing, not the breathing through the mouth and out through the nose, or power breathing, or all the different variations of breathing. I'm talking about the good old basic breathing, biological breathing. If you had subscribed to my channel, you'd know exactly what biological breathing is all about. If you haven't, please make sure you do, but we'll make sure that we put that biological breathing at the end of this video so you get a chance to practice it. There are so many benefits in breathing this way. Biological breathing is inspired by watching babies all over the world breathing the same way. Biological breathing is done through the nose for both inhalation and exhalation, breathing in and breathing out. If there is one very good reason why this has to happen. If we were to breathe in or out through our mouths, we would not be able to nurse and breathe at the same time. That's a dead giveaway that it needs to be done through our noses. So we just need to duplicate how we breathe as a baby, that then over a course of time, as a compensation pattern, we deviated from that way of breathing. When we breathe biologically, we utilize our rib cage differently. We use it properly. We use our diaphragm, abdominal diaphragm, pelvic diaphragm, and the vocal diaphragm correctly, all of which are absolutely necessary for proper positioning of rib cage, mid back, and beyond. So what I'm suggesting here is for you to go beyond that, what's on the surface, and pay attention to what needs to be in place before you have a chance to basically move properly and use your body parts correctly. I hope this made sense. If you have not subscribed to the channel, please make sure you do. If you have any questions or comments, use the opportunity to comment below. I specifically myself read these questions and comments and reply to them accordingly. Thanks for watching.